Hello, beautiful souls. I'm Dr. Anna Schneider, your friendly back pain warrior with over 20 years of experience helping people just like you reclaim their strength, their comfort, and their lives. Today, we're diving into something so many of you incredible women have asked me about: lower back pain during pregnancy. Oh, I see you nodding out there. Yes, you, the amazing mama-to-be who's growing a tiny human while juggling everything else life throws at you. You're a superhero, and I'm here to arm you with the tools to feel like one again. Pregnancy is a miracle, but let's be real, it can feel like your lower back is staging a full-on rebellion. The good news? You don't have to just deal with it. You're stronger than you think, and I'm going to show you how to take back control of your body, step by step. So, grab a comfy seat, or a pillow if you're already feeling that ache, and let's get started. Stick with me, because by the end of this, you'll feel empowered, informed, and ready to tackle this like the rock star you are. Oh, and don't forget, I want to hear from you in the comments. Where are you watching from? What's your biggest pregnancy back pain struggle? Let's connect, I'm your partner in this journey. Let's kick things off with the why. As a doctor, I've seen countless women come into my office saying, "Dr. Anna, I don't get it, I'm healthy, I'm active, so why does my back feel like it's betraying me?" Here's the truth, your body is doing something extraordinary right now, and that comes with some changes. First, there's the weight gain. That beautiful baby bump? It's shifting your center of gravity forward. Your lower back, specifically the lumbar spine, has to work overtime to keep you balanced. Picture this, your spine is like a suspension bridge, and suddenly, it's holding up an extra 20, 30, even 40 pounds. That's a lot of pressure. Then, there's the hormone situation. During pregnancy, your body releases a hormone called relaxin. Yes, it sounds chill, but it's a game changer. Relaxin loosens up your ligaments to prepare your pelvis for delivery, but it doesn't stop there. It affects all your joints, including the ones in your spine. So, your lower back? It's suddenly less stable, and those muscles around it are screaming, "Help me out here." And let's not forget posture. As your belly grows, it's natural to lean back a little to balance. That exaggerates the curve in your lower back, what we call lordosis, and puts extra strain on those lumbar muscles. Add in fatigue, maybe some swelling, and bam, you've got a recipe for discomfort. But here's where I get excited, because understanding why this happens is your first step to fighting back. You're not broken. Your body isn't failing you. It's adapting to create life, and that's a superpower. So, let's talk about what you can do about it. What do you think? Is it the weight, the hormones, or the posture that's hitting you hardest? Drop it in the comments, I'd love to know. Now, before we dive into solutions, let's bust some myths I've heard over my 2 decades as a doctor. These are the things that keep women stuck, and I'm here to set the record straight so you can move forward with confidence. Myth number 1, back pain during pregnancy is just normal, you have to suffer through it. Oh, honey, no. Yes, it's common, about 50 to 70% of pregnant women experience it, but common doesn't mean you're doomed. You don't have to grit your teeth and wait for delivery day. There are ways to ease it, and I'm going to walk you through them. Myth number 2, rest is the only answer. I get it, when your back hurts, you want to lie down and stay there. But here's the science, too much rest can actually make it worse. Your muscles need movement to stay strong and flexible. We're not talking marathons, small, smart moves can change everything. And myth number 3, it'll go away on its own after the baby's born. Sometimes, yes, but not always. If you don't address it now, you might carry that pain into motherhood, and you deserve better than that. You're building a foundation for your future self right now, let's make it a strong one. So, what myths have you heard? Maybe someone told you, "Oh, it's just pregnancy, suck it up?" Share it below, I'd love to debunk it for you. Alright, let's get to the good stuff, solutions. These are my go-to strategies, backed by science and years of seeing them work for my patients. You're going to feel like a warrior taking charge of your body again. Ready? Step 1. Posture Power. First up, let's talk posture. I know, it sounds basic, but it's a game changer. When you stand, imagine a string pulling you up from the top of your head. Keep your shoulders back, your chest open, and avoid locking your knees. When you sit, use a small pillow or rolled up towel behind your lower back to support that natural curve. It's like giving your spine a little hug. Try it right now, sit up tall. Feel that shift? That's you taking control. Step 2. Gentle movement. Next, let's move. I'm not saying you need to hit the gym, pregnancy isn't the time for that, but gentle exercise can be magic. Walking is your best friend. Start with 10 minutes a day, and build up if you can. It gets your blood flowing, eases stiffness, and strengthens those core muscles supporting your back. Another favorite? Prenatal yoga. Poses like cat-cow stretch your spine and relieve tension. If you've never tried it, picture this: you're on all fours, arching your back like a cat, then dipping it down like a cow. It's soothing, and it works. Have you tried yoga before? What's your favorite stretch? Let me know. Step 3. Heat and cold therapy. Now, for immediate relief, heat and cold. If your back feels tight, a warm compress or heating pad on low can relax those muscles. Think of it as a mini spa moment for your spine. If it's more of a sharp ache, try a cold pack wrapped in a towel for 10 to 15 minutes. It reduces inflammation like a pro. Just don't overdo it, your body's sensitive right now. Which do you prefer, heat or cold? Step 4. Support gear. Let's talk gear. A maternity support belt can be a lifesaver. It wraps around your belly and lower back, lifting some of that weight off your spine. I've had patients say it feels like a gentle hug that keeps them going all day. Pair it with comfy, supportive shoes, ditch the heels for now, okay? Your back will thank you. Step 5. Sleep smart. Sleep is huge. If you're waking up achy, try sleeping on your side with a pillow between your knees. It keeps your spine aligned and takes pressure off your lower back. I recommend a firm mattress too, not rock hard, but supportive. You're worth investing in your rest, mama. These steps are simple, but they're powerful. Start with one today, maybe that posture tweak or a quick walk, and build from there. You've got this. Now, I'm all about empowering you to handle this at home, but as a doctor, I have to give you the heads up. Sometimes, back pain signals something more. If your pain is severe, constant, or comes with numbness, tingling, or trouble walking, call your healthcare provider ASAP. It could be something like sciatica, where a nerve gets pinched, or, rarely, something more serious. Same goes if you've got fever, bleeding, or contractions with the pain. Don't wait. You're not overreacting, you're protecting yourself and your baby. I've seen too many women brush it off and regret it later. Trust your gut, you know your body best. Has anyone out there had to see a doctor for this? What was your experience? Here's something I've learned in 20 years, your mind plays a huge role in pain. Stress, anxiety, even the overwhelm of pregnancy can make your back feel worse. Your muscles tense up when you're stressed, ever notice that? So, let's add a secret weapon, relaxation. Try this: sit quietly for 5 minutes, close your eyes, and breathe deeply. In through your nose for 4 seconds, out through your mouth for 6. Feel your shoulders drop, your back soften. It's not woo-woo, it's science. It lowers cortisol, your stress hormone, and eases muscle tension. Pair it with positive affirmations. Tell yourself, I am strong. My body is capable. I've got this. Say it out loud right now, I dare you. How does it feel? Share it below, I'm cheering you on. Here's the big picture: everything you do now isn't just for pregnancy, it's for the incredible mom you're about to become. Strengthening your back today means you'll lift that car seat, chase that toddler, and rock motherhood with confidence. You're not just surviving this, you're thriving through it. Think of your body as a temple. You're building it brick by brick, every stretch, every mindful breath, every choice to prioritize yourself. That's power. That's pride. And I'm so proud of you for being here, learning, and taking action. What's one thing you're committing to today for your back and your future? Tell me in the comments. Well, my friends, we've covered a lot today: why that lower back pain happens, myths to ditch, and real, doable steps to feel better. You're not just a pregnant woman with back pain, you're a force of nature, and I'm honored to be in your corner. If this helped you, hit that like button, it tells me to keep bringing you this goodness. Subscribe if you haven't, I've got more tips coming your way. And please, drop a comment below, where are you watching from? Are you in New York, London, Sydney, or somewhere else? What's your biggest takeaway, or your biggest struggle? Let's keep this conversation going, I read every single one. Until next time, keep shining, keep moving, and know that you've got the strength to conquer anything. This is Dr. Anna Schneider, signing off with a big virtual hug. See you soon.